Welcome to my presentation on oral health as it relates to older adults. My name is Jenny Schuler. I'm an oral health advocate, and I am really excited to be here to talk with you today about the connection of oral health and older adults. I'd like to first thank the Washington Dental Service Foundation and Whatcom Community College for providing this opportunity for me to speak with you today. So our objectives are to understand the connection of oral health to overall health and the impact that that has on health outcomes. And I want to identify some conditions that older adults are at risk for, possibly at risk for. I want to recognize some behaviors, limitations, and barriers to achieving oral health for this population, and identify some navigation opportunities for you that you can help improve oral health for this age group. So I want to step back to 2000 when our Surgeon General made this statement nationwide: you cannot be healthy without oral health. And it was based on a lot of statistics that we had collected, that there was a big oral health problem and that there was some link to systemic diseases. And so it kicked off the opportunity to really do a lot of research, and we've learned more and more about that link. So when I think about why do we want to address oral health with you as navigators, we have the opportunity because you talk to the clients, you talk to the family members, the providers, about oral health, and then they realize it's really important. We can tie it all together in that team. I also think that your clients expect us to talk about oral health when we are looking at other lifestyle behaviors. And as a navigator, you have the opportunity to take a look at risk factors and promote prevention and provide important oral health messages and offer resources. So I appreciate your partnership on this, and I see that you could help clients also achieve healthy goals. So that's another opportunity. So I wanted to talk a little bit about oral disease and if it goes untreated. We want to remember that oral disease is preventable, but if it isn't treated, this is the impact to people. They will end up in pain, which makes it difficult to sleep or to eat, maybe to process information, depending on the severity of the pain. It could create poor eating habits and nutrition. It lowers your self-confidence when you feel like that, or you have decayed or missing teeth. And certainly there's infections included in that, and it can complicate chronic diseases like diabetes. So when we look at this population of adults 65 and older, we know that they have more complicated dental needs. They are retaining a lot more of their teeth than they used to. They can acquire and do acquire chronic conditions, and they take more medications due to that. And when we surveyed in Washington State the adults at 65 and older, 17% of them said they do have poor or very poor oral health. And if we look at the prevalence of oral disease in that age group, 20% of them have untreated dental decay, and 70% of them have periodontal disease. And that increases with age. And a quarter of them have not seen the dentist in the last year. So I wanted to review a little bit about gum disease. So on the picture on your left, we have what we call gingivitis. It's a very beginning stage of gum disease. It's caused by inflammation, the plaque that's left on your teeth that you haven't cleaned off each day. It is reversible at this stage. You can see that those gums are puffy and red and inflamed and probably would bleed if you touch them. But if it's caused just by that soft plaque, we can actually go in and brush and floss, maybe rinse with hydrogen peroxide on a daily basis, and get those gums back to health. However, if we let it continue and the plaque actually hardens on your teeth, becomes calculus or tartar. And in that picture on the right, you can see that now that calculus and tartar has caused the gums to recede, the bones to recede. So really creates a more severe inflammation and disease problem and can be linked to chronic disease. So when we look at that oral disease linked to systemic disease, we know that people that have serious gum disease, that severe periodontitis, they're 40% more likely to have a chronic condition as well. And we know that there is a link between that periodontal disease via that inflammation to heart disease, respiratory infections, diabetes. And the other thing that comes to mind for me is if someone has a disease or a disability that gets in their way of taking good care of their teeth, that like dementia, they may not remember to take care of their teeth. They may not remember how to take care of their teeth. And then certainly medications that cause dry mouth, which I'll talk a little bit more about in a minute. But that's really important as well, because if you don't have enough saliva in your mouth, it really puts you at more risk for decay and gum disease. And I always want to bring this message that prevention works. So if we are going in on a regular basis, brushing our teeth twice a day, spending 2 minutes at that time when we're brushing, and particularly right before bedtime is really important. And then flossing once a day. So we're getting that bacteria out from in between our teeth where our toothbrush just can't reach. And we can use fluoride supplements to strengthen our teeth with toothpaste, mouth rinse. Maybe you have fluoride in your water supply. And certainly the dentist, seeing the dentist on a regular basis is so important. So I also wanted to talk a little bit about oral cancer. That is a screening that we do on a regular basis when you come to your dentist. And I think it's so important to do that because when you look at these statistics, 30,000 new cases of people that have oral cancer per year and 8,000 deaths per year. And certainly your clients that use tobacco or alcohol are at higher risk. And it's interesting because oral cancer in the very early stages is painless usually, but we recognize symptoms like sores that don't heal within 2 weeks, lumps, bumps, red, white patches, difficulty chewing or swallowing. So really important to have that assessment done on a regular basis at your dental office. And if we do find oral cancer and refer them for treatment, we can do surgery, chemotherapy, radiation treatments, but then we also have to follow up with helping them with possible consequences, keeping our eye on that dry mouth that I talked about before, tooth decay, infections. It's possible that when you go through those kinds of treatments that you have a change in the way you taste food, and you sometimes change how you eat because of that, and then that can impact your nutritional intake, which then could increase your risk of tooth decay and gum disease. So it's all related. It's all interrelated. So I did want to talk a little bit more about that dry mouth. It actually is caused by hundreds of medications. It's a side effect. And I think it's important to know that when you have a client that has a chronic disease and is taking medication, this is a possibility. And they might not always recognize it. Unless it's really severe, then it's really hard to ignore. But they may not recognize it because they may just think that's normal for them. But what we can do in the dental office is assess whether or not it is dry mouth, and then we can help them with different kinds of products. Like for instance, if you have a product like a chewing gum or a lozenger that has xylitol in it, that's a natural sugar substitute that if you use regularly throughout the day, it actually prevents decay. So there are lots of opportunities there. There are products that actually enhance the saliva in your mouth, and that's helpful. And certainly the important routine dental care on your own and dental treatment at the office, the clinic. So when I think about nutritional concerns and I think about this age group, it's possible that they are not getting adequate meals, that adequate nutrition intake. And it might just be that they have a failing appetite. They're just not that interested in eating. We do lose taste buds as we age. So we have half as many at the age of 75 as we did when we were 30, and that will have an impact on your interest in eating. Maybe they're just eating small quantity meals, or maybe they're on a soft diet for a medical condition. Maybe there's barriers, financial access to healthy foods. So lots to think about when we're talking to our clients about nutrition. And then again, maybe they aren't able to make their meals efficiently because they have some disabilities like arthritis or limited movement or vision problems or mental health issues. So lots to think about there as far as advocating for our clients in the nutritional realm. So when I think about navigation opportunities for this age group, I really encourage you to share oral health concerns. Talk to your clients about sharing their oral health concerns with both their dental and their medical providers. I think it's important that we create this team, this care team, where we all have similar messages and we all have the same information, because medical providers can help us get our clients to dentists, and dental providers can help get our clients to medical providers. We actually often can see what looks like a symptom of a chronic disease in the mouth, and we can refer them out if they haven't had attention to that. So lots of connection there. You can work with your clients on setting oral health goals. Maybe it's nutritional. Maybe they're sucking on lemon drops. Lots of older people like to suck on sugary candies ongoing, and that certainly raises your risk for decay. So maybe we say, how about if instead of sucking on the lozenge or the lemon drop, you substitute it periodically through the day with cheese or with a vegetable, and we try to help them set that goal. We can also educate them about prevention and management of oral disease and the impact that it has on their chronic conditions. And certainly referring them to the dentist doctor when needed, and offering resources, which I have brought some Whatcom County and state resources to you today. So here in Whatcom County, we have the community health clinics, CMAR and Unity Care, and they see clients, patients as we call them, on a regular basis on a sliding fee scale. So you can go there no matter how much or little money you have. We also have the technical college that has the dental assistant and dental hygiene clinics that are open to the public at a lower rate than private clinics. We have the dental hygiene and their partnering dentists in the Smiles for Life program at our senior center here in Bellingham. The hygienists will see the patients, they educate them, they work with them on prevention techniques, they assess their dental needs, they clean their teeth, and then they refer them to their partnering dentist for the dental treatment that they need. And I would also say that WAHA, better known as Whatcom Alliance for Healthcare Advancement, is another organization that supports our community members in both medical and the dental realm. So if they are having trouble, if your clients are having trouble finding access, that's another opportunity for you to call WAHA. And along with our resources, we also have the Lummi Tribal Health Center and the Nooksack Tribal Dental Clinic. And they are open to our Native American members of our community on a regular basis. And then once a year, we have Whatcom County Project Homeless Connect. And that's an all-day servicing for anyone who is experiencing homelessness at this time. And Unity Northwest opens up their dental clinic and does dentistry for these people all day long. They volunteer their services, they volunteer their time, they volunteer their equipment, their supplies. And so it actually can create a dental home, not emergency, but on an annual basis for people that are experiencing homelessness. I also wanted to bring statewide access resources. We have 2 nonprofit dental clinics, one in Federal Way, one in Vancouver. We also have other Smiles for Life programs through the senior centers throughout the state. And we have many college dental programs all across the state, including the University of Washington down in Seattle that has a dental urgent care clinic and a peds clinic and a clinic for people with disabilities that they call Decode. So those are really great resources for you statewide. And we have donated dental care programs through Project Access and Union Gospel Mission, and certainly other community health centers throughout the state. And then we have a family health hotline that's sponsored by an organization called Within Reach. And their goal is to provide access for anybody in the state of Washington to medical and dental. So I would really recommend, if you get stuck and you haven't been able to find a resource for access, call that family health hotline and let them help you. So I just want to thank you for being a part of improving oral health for our community, and I consider you all champions, and I really appreciate you, and I'm glad that you're part of our team. So thank you.